If you're wondering what Medicare Part A, the hospital coverage, doesn't cover, you've come to the right place to hear exactly what it doesn't cover. So Medicare Part A, as we've discussed before, so we can kind of recap, is the hospital side of Medicare. See, Medicare is different than group and individual or Medicare Advantage Part C plans, which include all the healthcare services in an all-in-one plan. Medicare Part A is known for inpatient hospitalization and will also cover other things like skilled nursing facility care, home health care, and hospice care. So let us look at some of the services that currently right now, as of July 2021, Medicare Part A will not cover unless it's determined that it is medically necessary. So the very first thing that we're going to discuss about Medicare Part A is this: skilled nursing facility admitted 3-day rule. So it's worth going over this again, the admitted versus under observation rule when it comes to the Part A hospital. We went over this in a previous video, but it's good to go ahead and recap this. So in the previous section, we discussed that a skilled nursing facility must be viewed as a direct extension of the inpatient hospital stay. So we refer to the skilled nursing facility as a pit stop between the inpatient hospital stay and being able to go home and not needing 24-hour care. So Medicare requires that an individual be admitted as an inpatient to the hospital for at least 3 days in order to be covered under Part A in a skilled nursing facility. If the individual is placed under observation during that hospital stay, it will not fall under Part A. The hospital stay would fall under what's called Part B, which would not cover a skilled nursing facility stay, regardless if that individual had spent the 3 days in the hospital. This is somewhere where Medicare just doesn't make any sense. So this has been a big topic for Congress, but as of July 2021, it has not been changed. So for Medicare to cover a skilled nursing facility stay, it must, and let me repeat this, it must fall under Part A. So the other thing that Medicare doesn't cover is it doesn't cover a private room in a hospital or a skilled nursing facility. So if someone's admitted to the hospital because of, say, an unfortunate situation to treat an illness or an injury, Medicare Part A will not cover a private room. So the same will hold true if an individual went to a skilled nursing facility. Medicare is going to try to save on the cost, and that individual will more than likely be in a room with what I call a roommate. So if it's determined, though, that it's medically necessary for that individual to have their own private room, guess what? Medicare will cover it. There's always an exception to the private room, but someone can't just request or expect that Medicare Part A will cover a private room. So Medicare Part A will not cover also private doctors or nursing care. So the doctors and the nurses that are assigned to someone will also be treating other patients in that hospital or facility. So last thing is this: personal items like razors, deodorant, toothbrush, toothpaste, and slippers are typically not covered by Medicare Part A. Any type of toiletry will be the responsibility of the individual in a hospital or a skilled nursing facility. We'll talk about this right now, which we talked about in a previous video, is the first 3 pints of blood. Medicare Part A will not pay for the first 3 pints of blood unless the blood bank does not charge them for it or someone has actually donated the blood specifically for that individual. So 1 pint of blood can typically save up to 3 lives. So if you wonder what a pint does, a pint can actually save up to 3 lives. So if for some reason someone needed more than that, it would more than likely be a very, very critical situation. So the cost for a pint of blood is usually sold to a hospital for around $150. So if you wondered how much a pint of blood costs, it's usually sold to a hospital for around $150. So a benefit that we talked about previously in another video, a benefit to a Medigap supplement plan is that it will actually cover the first 3 pints of blood that Medicare Part A will not cover. Foreign travel has always been a big topic when it comes to Medicare Part A. So foreign travel is usually not covered under either Medicare Part A or Part B. Now there are some exceptions to this rule. Those exceptions typically include if that individual is on board a ship that was in territorial waters joining U.S. land, or the foreign hospital is closer to the nearest U.S. hospital, then that would be an exception. So it's important to always keep in mind that original Medicare was designed for treatment and coverage in the United States and not for foreign travel. So here is our advice to you. Get travel insurance when you're going abroad. So when an individual is going to be traveling abroad, the best advice is to look at additional foreign travel coverage. An individual should contact their credit card company to see what existing coverage they may have for foreign travel as a member. I did this on a foreign travel trip where my credit card actually covered some services for me. So many credit cards will have built-in travel insurance that might be enough coverage for you if you are traveling and for that individual. So if the credit card does not offer that coverage that's needed for you or that individual, there are some additional policies that someone can purchase by just searching Google travel insurance policies for seniors on the computer. So if you're looking for travel insurance, just type in travel insurance for seniors. So a big question that we get here at Healthcare Solutions Direct is, do Medigap supplement plans cover foreign travel insurance? And the answer to that question is yes. Medigap supplement plan CDFGMNN will offer foreign travel emergency care as an additional benefit that's not offered by original Medicare. So that's a little bit of a perk for having a Medigap supplement plan. Let me explain to you exactly how that perk actually works so you're fully aware. There is a lifetime benefit of $50,000 that's offered under the plan that can be used during the first 60 days of each foreign travel trip. There is an initial $250 calendar year deductible under the plan, and the individual is responsible for a 20% coinsurance up to the $50,000 lifetime benefit. So for example, if you're traveling and the bill is $10,000, you would have a $250 deductible that you would be responsible for, and then the Medigap company would cover 80% of that, and then you would be responsible for the other 20%. So in that particular example, if it was a $10,000 bill, your responsibility would be $2,250, a $250 deductible, and the 20% for the $2,000. So some Medicare Advantage plans, though, will offer some additional benefit for emergency foreign travel. If that's a big topic for you that you really want to talk about, please reach out to us here at Healthcare Solutions Direct so we can look at the different Medicare Advantage plans as well as the Medigap supplement plan so we can see exactly what is best for your needs. We've left this last one because this is the big one. Nursing home care. This is something that a lot of individuals don't really understand. So again, you're going to be an expert at the end here. Nursing home care is the biggest and the most misunderstood topic when it comes to what Medicare will actually not cover. Nursing home care always comes up as the very first thing that Medicare Part A will not cover when people search what Medicare doesn't cover. It's usually listed as long-term care, also called custodial care. Medicare will cover part-time or intermittent care for things like skilled nursing facility and home health care because they're predictable and they have an ending point to them. Medicare will not cover what the dictionary defines a nursing home as: a private institution providing residential accommodations with health care, especially for the elderly people. So here's a better understanding of nursing home care so that you're an expert. A nursing home is for someone that will need help with everyday activities like dressing, feeding, bathing, and toileting, and will need their meals provided for them because they can't do it on their own. Here is the big news. The cost associated with a nursing home can be very, very expensive. The average nursing home cost can be around $8,000 a month or higher. So the question is this: if someone can't afford the $8,000 a month for a nursing home, which a lot of people can't do, if someone can't afford the cost of the nursing home, they would need to liquidate their assets and exhaust their savings in order to qualify for assistance under their state's Medicaid program. Medicaid is the most common way to pay for nursing home care for an individual that does not have the means to afford that care.